Okay, good afternoon, everyone. Thank you for the organizers
For inviting me.
to share my ideas with you. I'm not coming here with a prepackaged set of slides or ideas. What I would like to offer are reactions to extremely rich discussion that we had this morning and to a lot of interesting questions and observations that were made by many of you. I would like to have three parts to my presentation. One is that I'm going to go back to our discussion and thinking about the SDG, Sustainable Development Goals. So far, we focused on one specific goal, which is formulated as Goal 1, Target 1.3, and that talks about extending social protection coverage. And a lot of our discussion and effort actually goes into clarifying those issues. I will come back to this goal and the discussion we had here in the second part of my presentation. But I would like to start again with the overview of the role of social protection in different parts. And we heard already this morning about many parts of the Sustainable Development Goals that have direct connection to the social protection. I will mention a few that were not mentioned here, just to put it back on our radar screens and sort of bring back the discussion to trying to instill the need for monitoring social protection action in all of those different targets and goals. Then I'm going to talk about specifically our main point of discussing here, the coverage, what we mean by it, what is the consensus that seems to be emerging in this rich exchange. And then I'm going to share my confusion and offer some provocative questions and insights that we can discuss together. This is, after all, a very open discussion that I really enjoy. So in addition to the goal of covering those in need with the social protection systems, there are also other goals and targets which are importantly very closely connected to social protection. Some of them were mentioned, but some of them I believe are not. And one of those goals is, for example, is building resilience, right? Resilience is a very important part, and it looks like significant part of resilience to climate shock, to economic shocks, is actually having people covered by the social protection system. So we should be thinking about what difference social protection has in promoting resilience and how we are going to measure it. But in addition to resilience, there are others. There is also a very important aspect that we discussed. It's universal healthcare coverage and the specific mechanisms and instruments, institutions that we use to achieve both universal universal health coverage, but also protection against financial risks. There are really serious questions about implementation. Then there is in education part, there is a very significant mention of scholarship. And social protection plays a very significant role historically in providing people with scholarships. So we should not forget about this. Then we already mentioned the goal 5, the gender equality, and a very important innovative feature of recognizing work at home and the care. And again, the importance of social protection in ensuring that this is indeed happening and the investment in human capital is taking place. Then I would say goal number 10, increasing inequality, really based on the discussion and the documents that we saw, requires really significant thinking about how we measure the role of social protection in ensuring greater equality. And specifically adopting fiscal wage and social protection policy to achieve this goal. Then this goal also has mentioned as a target well-planned migration policies. Migration, as already mentioned in the discussion, is a very important challenge for social protection and is actually an indispensable element to make migration a manageable flow that contributes to the development. Goal number 11, development of inclusive cities. It's actually essential to use social protection in helping people to move where opportunities are, and cities is where the opportunities are. Among the 10 fastest urbanizing countries, 9 are in Africa. And this is where the combination of fast urbanization And low income poses specific threats, but also opportunities for social protection. Hence, a need to monitor it really seriously, including building resilient cities, which is another target where social protection should, in fact, be part of the plan for building resilient city. I'm skipping the climate change because it was already mentioned, but I'm going to say a few words about violence. Violence prevention is actually a very important aspect of why countries are pursuing a social protection avenue in their policies, specifically conflict-affected countries and fragile states. And the ability to deliver social cohesion and reduce violence is a very important and powerful effect of social protection that countries are seeking. And we need to actually help to see what kind of social protection and what kind of instruments and targets can help to deliver on this promise. So let's not forget all of these various aspects. If you see, really social protection is embedded in many of the goals, and it has to be done this way because that is what is going to ensure that the social protection is regarded as truly transformative. Now, going back to where we have a consensus, coverage of social protection, whether it's universal or it has to be specifically focused. It looks like there is a consensus that social protection goal of achieving universal coverage for all is shared by all present here. And this is, in fact, the goal that we also embrace at the World Bank. For us, it's a very important aspirational goal. That is why we are supporting the social protection floors initiative as aspirational goal that we use in our dialogue, in our thinking about the future. So this is really important, right? So we all come in, there is no disagreement that universality principle is important. But where it brings to this panel is the question of how we are going to implement it. One is to proclaim in principle. The other one is how to design steps, how to get there. There is no disagreement about the vision where we want to get, but there is a question and some confusion about how and what we should be doing first, what we should be doing second, what we should be doing third. And most importantly, what is the role of national governments in deciding what are their priorities in that respect. So here I would like to actually step a little bit back and ask a question of what we seem to be agreeing. We seem to be agreeing that given everybody the same amount of money, a small transfer, is not what we mean by universal social protection. It's not what we mean by having access for everybody in need to social protection. Social protection is much richer. It not only transfers, it's also services, and it's responsive to the needs of people in the life cycle, right? We talked about it, and here we are professionals, we understand what it means. It means a much richer menu than just giving everybody an equal amount, right? This is not equality. Equality means when social protection is responding to the need. The question is how we are going to measure those needs, because the needs are so varied, and they cover so many aspects. How we are going to measure the progress, how we are going to set reasonable targets. And here, I want to actually emphasize that it's not by accident that we are saying that the poor and vulnerable are the ones who are so important in how we specify this goal, why it is so. The poor and vulnerable are typically people who are facing the definition of poverty, unacceptable level of deprivation, according to any society preferences and views, right? People are already in unacceptable level of deprivation and suffering. Therefore, this is where the needs is manifesting in the most acute and apparent way. If a poor person is there, he or she needs to be covered by public help. The public help is coming in the form of social protection. Therefore, ensuring that all of the poor people who are in need by definition are covered by social protection measures is something that is very clear, transparent way to ensure that we indeed are making a progress in achieving universal coverage, right? Access and need is not always there. People experience high levels of need, lower levels of need, ensuring that the system is there And measuring the presence of the system that has universal access is a very simple way, looking at how many poor people who are poor at this moment have access to those mechanisms. If it is 100%, then I can claim with a reasonable degree of certainty that system is really ensuring universal access. This is not about deciding who merits more assistance, who merits less assistance. This is measuring. This is not normative statement. This is not what countries should be doing. This is how we can assess whether the system has enough capacity to cover everybody in need. So it is objective, it is positive. It's not normative. It's not the objective we want to achieve. Objective we want to achieve is universal coverage for everybody in need. The way how we operationalize is at least ensuring that all the poor people have access to social protection measures. And as we discussed, this is well within reach. And unlike proclaiming that everybody in principle should be covered by social protection and just looking at the percentage of population at large who is participating in different schemes, the objective of coverage of the poor and vulnerable is actually more, if you wish, attainable, and at the same time it is more ambitious. Because as we know from data, global data from around the world, this is precisely the group that is most difficult to reach. And this is precisely the groups where the need are the greatest. So if that is the way how we operationalize the universality of social protection, then the question is becoming what are ways to achieve it. And as we said, this is not about giving everybody small amount of money, right? This is about really being responsive to need. And that means having a system in place. We just produced a report on the state of safety nets in the world, 2015, where we were trying to use administrative data. And we could find administrative data from 120 countries, basically doing an inventory of all programs that exist in social assistance in these countries, the number of beneficiaries they cover, and the amounts of money that is spent on these programs. So we found that on average, a country in the developing world now has 20 social assistance schemes. Not social protection, just in social assistance. An average country has 20 schemes, right? So it is a system. Whether we want it or not, it's already a system. It can be a bad system, it can be a good system. But for us, it's very clear that it is a system. And what we discuss here is the systems agenda. Right?
Very briefly now, if you will, Russell.
These programs need to be better coordinated. How? How we can measure the progress towards system. And this is precisely where we lack some clarity here. Right? We lack a clarity how we are going to measure whether the systems are doing good job, whether they are making bad job, how I'm measuring progress. There is some promise in the development of interagency social protection assessment tools. Maybe we are going to achieve some metric that will help us to assess the progress in systems building, but it is a big agenda where I believe we should focus a lot. Finally, what are the confusions that I wanted to share with you, and contradictions? One contradiction that is apparent to me is the diagnosis that we share, that most of the poor who are not covered by social protection, or people in general who are not covered by social protection systems, are in middle-income countries. And opposed to this is our political preference or view that we should be helping most the poorest countries, right? It's whether we should be helping countries which host majority of people in need versus countries that are the poorest. This is a very important debate to have, and it's a very important trade-off, right? And I feel there is a confusion. On one hand, we recognize where the problem is. On the other hand, we all seem to be focusing on low-income countries as the primary field for action. The second one is that there is so much mobilization that is going on in our attempt to build the systems, and I think we're still having a lot of debates that are sort of reflecting our past. The role of temporary assistance versus the role of permanent assistance, the role of targeted versus universal programs, the role of conditional transfers versus non-conditional transfers. I guess these are all details of implementation that are important, debated in each country according to its own circumstances and preferences. What we are here is actually helping to mobilize support for these countries, but it's very hard here to decide on the principles without actually having a particular circumstance in mind.
Can you wrap up now, Ruslan, so we can get into the discussion?
And the final confusion that I have, which I keep on having and I would like to share with you, is one of the questions that was about illegal migrants, right? How we are covering illegal migrants or people who should not be in the country. We're actually working in a lot of countries where the action of national governments is driven by pushing out people who are illegal in these countries. And from our humanitarian perspective, these are precisely the people who need our help most. How we are dealing with this, because we still seem to be in the same duality, development versus humanitarian approach. And we cannot still breach the divide that exists within our community. I believe this is very important to address, to present a more common view to the Sustainable Development Goals agenda. Thank you for your
Thank you very much indeed, Ruslan. Thank you. Do come and take a seat. And I'm sorry to have hurried you, but you're raising so many interesting points. I want time to... is this working, or is my voice just being loud? Yes? Interpreters can hear me? Great. Sorry, I wasn't sure. It's been going on and off a little bit. Let me bring up the rest of our panel to join that discussion and address some of those issues Ruslan has been mentioning. Anne Drouin, who is Director of Public Finance, Actuarial and Statistical Activities of the Social Protection Department at the International Labour Organization. Welcome to you, Anne. Dr. Fabio Veras, who is Research Coordinator at the International Policy Centre for Inclusive Growth. And last but not least, Francesca Bastagli, who is Head of the Social Protection Programme at the Overseas Development Institute. Francesca, a warm welcome. Make yourselves at home. You have some microphones to share, and we're going to just dive straight in. I'm going to ask a few questions, and then I will come out to you for your questions and comments to what you've heard. You had time to reflect on the high-level panel now, and also on what's being said here. So if I can just dive straight in and ask you each to really react to what you have heard in terms of, in the high-level panel, they identified what they saw as the challenges. We've heard Ruslan there really nail down some of those absolutely crucial issues. What, for each of you, are the most important challenges that we need to address in order to ensure effective financing and implementation of these systems in the future? Anne, a thought from you first, if you would.
Thank you very much. Well, certainly, without wanting to be repetitive of everything that's been said, we've had very high level of discussion so far today. Certainly, the universal coverage dimension, as Ruslan has rightly pointed to, deserves very careful attention. And we still remain puzzled by the fact that we would define universality on the condition of available resources. What's a most starving child versus a mildly starving child? Are we going to have to choose in between the two? So the unacceptable forms of social protection needs need to be also shouldered by the global community as a responsibility, and not only for the countries. Certainly, as was said earlier, having the resources and the means and the efforts put together to kickstart social protection systems so that we look at systems as a whole and not anymore at fragmented approaches as we've seen, and that we ensure that these multiple dimensions that seem to be perceived as complicating the debate are instead put into the context of social dialogue and national dialogue with those for whom the choice is made. They have the means. In Africa, nearly all countries have their social protection strategies. Why is it that the international community still comes to these countries and pushing through its own priorities? Why is it? We see it almost in all countries, perhaps with the exception of countries like Rwanda and Ethiopia. Is this what's needed to have respect of the autonomy at the national level? So let's listen to those developing countries and the people. Let's see what we can modestly and with humility bring in terms of capacity to develop laws to help politicians pass those laws and make sure that the executive government arms actually implement them with sufficient budgets, because we're talking of la guerre des pauvres in many of these countries. We're asking them to achieve a lot with nothing. Many of us know what that means also in our respective institutions, but surely this is not going to bring about the results we need. And then let's talk about measuring progress. So those challenges are crucial to ensure that we also transform humanitarian aid. There are lots of resources available right now. We see in so many least developed countries in particular, we see amounts in the almost billions in some cases, completely focused on community-based approaches, which once the project is finished, doesn't leave anything sustainable. I've been involved with the Ebola recovery assessment, and we see a lot of pride being taken from having reached rapid actions by dealing directly from international agencies with communities. But what happens the day that international agency pulls out? Nothing, because the community does not have a mechanism to link up to the rest of the national priorities and budgets being set. So it's very important to get out of that dilemma of having to really focus on visible short-term results and rather focus on long-term results.
Okay, briefly now, if you would.
Yeah, and finally, social protection has a cost. It's not just an economic and investment. So these are the key challenges.
So that key point, that there is a cost. It isn't, but I think it's in terms of how you frame it and how you explain to people why they have to do it. But you raised a very important issue there about the lastingness of whatever you do, which hasn't really been touched on today. And also that key question again of the local ownership. How does the donor community, how do people help and support this process without taking away that ownership? We'll come back to all of that in the discussion. But Fabio Veras, from your point of view, the key challenges ahead, anything you would disagree with, anything you would add to what has already been said?
I'm not sure whether I'm disagreeing or just adding, but again, I think that the novelty on the language of the social protection is the adoption by the several agencies in many countries of the system word and what we mean by system. And I got the impression that when we talk about system, we talk about different things. So just to give an example, much of our discussion, much what we have seen is around the cash. So it's pretty much on the cash transfers. So the service world and the social service, that's something that comes to mind very easily when we are in Europe. It's something that's not much discussed in the international arena. So I think it's a challenge for we don't have any target in relation to that, but I think it's a challenge in the implementation of the system, how we are going to integrate the social service that's key on the social protection system to the cash transfer. So I think that's one of the missing gaps. And I think that's also a little bit universal as well. One of the biggest challenge that we have seen in our work at IPC, not only in Africa, but also in many countries in Latin America that usually take as a nice example to follow, is that the social security dimension and the social assistance dimension, the contributory and the non-contributory, they do not come together. So when we talk about coherence, we also need to talk about how the different dimensions of the social protection, how the labor policies, how the social assistance, the social insurance are coming together to be this means of implementation of development that Helen Clark was talking in the last panel.
So coherence means between different policy areas and not just within the system as a whole. So thank you very much on that. And your crucial point about services, which takes me back really in thoughts to when I asked this morning about what practical difference a rights-based approach, and part of the emphasis there, that is the obligation for the provision of services as well as the cash. We'll come back, I hope, in the discussion to that. But Francesca Bastagli, always hard. I've asked so many people now this question, the high-level panel are now you, but for you, where would you put the emphasis? Can you, Fabio, it's mic sharing time, yeah. No, it's all right, it's easy to forget. What for you are the most important challenges? Would you agree with what has been said? Is there anything you would put a different emphasis? We just had another element introduced there. What for you?
Well, generally, I agree. I think things have pretty much been covered. Is this on? Yeah. Just to re-emphasize, I mean, one issue that has, of course, come up, and we can perhaps talk more about, that relates to both
Try that one.
financing concerns and implementation, is the question of informality, the persistence of high informality, where in areas where we may have expected things to have been different or trends to perform differently, we see, including in middle-income countries, still very high rates of informality, and this has a number of implications, partly because, of course, social protection is not just social assistance. And even though here today we have very much talked about both contributory and non-contributory and systems, in practice on the ground, but still also in many organizations, the focus when we talk about social protection tends to be or continue to be on social assistance, which is extremely limiting, of course, because it's not just social assistance. Focusing only on social assistance has a number of implications, including around, well, of course, coverage, but also financing. And perhaps we'll get into this in a minute as well, but extending social insurance and getting people to contribute, employers and employees, is critical to ensuring the stability and financial resources of social protection. So this is just to add. Related to that, I just want to make one actually slightly separate comment around the indicators, just to move perhaps towards the indicators and data requirements. So data also is an issue which hasn't come up quite yet. We had in the earlier presentations this morning some mention of data sources in relatively positive ways, saying that the data are available. But honestly, actually up to a point, I think. So the truth is that even in terms of monitoring the indicators that have been proposed so far around social protection, there are a number of challenges. We do have access to some indicators for some programs or policies, less so for others. Of course, there's also huge variation by country. Data remains an issue. And with respect to Ruslan's reference to the coverage of the poor as an indicator that we would find valuable and relevant in monitoring progress, well, yes and no, because again, it depends how we define poverty. If we're using a very minimalist, extreme poverty line, there are concerns about that, and there are implications about how we and countries, of course, understand the priorities of social protection to be. So yes, it's true that a universal system may contain elements of targeting. I think we can agree on that. We know that there are degrees of targeting, that elements of targeting can lead to a more universal system, but the system does have to be universal, and that means that it doesn't just cover the poor. It needs to do much more than that.
Okay, thank you very much. Just on this point about data, because you raised something, as you say, that we haven't touched on much, and Ruslan talked about the targets and indicators. Helen Clark said we have to make sure that the targets are measurable and that we have indicators that contribute to this. So as we haven't talked about it, in terms of the data, do we have the picture we need? Do we, when we look at cooperation, collaboration, etc., are we sharing that information enough, sharing ways of collecting that information, because we talked about capacity building. So how do you see the situation in relation to data? Would you see that as one of the implementation challenges? And then this question of indicators, do we have the right ones? What's on the table? Is the focus right? It's obviously a very political discussion. It's not a technical issue, even though it's often portrayed as such. Where are we in terms of that? Ruslan, on the data, do we know what we need to know, or are there gaps? And if so, how do we address that?
No, the short answer to your question is no. And let me just cite one number here. There are 57 countries in the world which don't have a household survey data that measures access to services, including social protection, for the last 10 years. So if we are talking about monitoring progress for 57 countries, there is nothing, right? And chances are they will not be. So it's a big issue. A sizable chunk of countries don't have it. And even though there are now mechanisms to better share the data among agencies, we have really nice and promising initiatives at SPIAC-B level, I think the challenge is at the country level, the country capacity, to collect data and to actually use it for their policy purposes. So that's the first question on data. The second question?
Well, related, you mentioned, you already talked about you need to set reasonable targets, and you need to, how do you measure the progress? So in terms of the indicators, what's on the table? Are they the right indicators? Would you add to them? Would you change them?
Yeah, so now what we have in specific indicator for social protection is just for goal 1.3.
Yeah.
And I was trying to make a point we should have more for other goals. That would be helpful. For the goal 1.3, I believe we have an issue of global versus country. You see, now the way it's formulated is that we are offering a menu of options. Percentage of the old people covered by pension, percentage of families with children covered by child programs, percentage of people with disabilities covered by programs, and so on. And countries have an opportunity to pick one or more of these, which makes this indicator really non-comparable across countries. So it would be, if we implement it that way it would be impossible to track the progress of the world globally in social protection coverage. I'm really concerned about that. I think we need to have one indicator that will be clear with examples and setting a very clear goal for the world.
Okay. Anne, a word, if you would, you're a statistics lady, about the data question. But then on this question of the... I think you have advocated for a global database. How would it work? How can it work? What do you see as the challenges? And a word on indicators and whether you think what we've got, whether we've got the right one when we have got one, and whether we need more, as Ruslan is saying.
Well, I'm not as pessimistic as Ruslan. I think what matters is on 1st of January 2016, what is each country going to do to meet its targets, and how are they going to measure their own performance? And that's what matters at the end of the day, more than reporting at general UN or other level meetings. So what is important is, as we have clearly said throughout the days, each country is setting their own priorities and deciding on what are the universal coverage that they aim at. So therefore, the ILO has established the Social Security Inquiry, which dates back to 1949, and which is adapted to the IMF Government Finance Statistics Framework for functional distributions of expenditure data in particular, but not exclusively. We've mimicked on the coverage side how this represents also the system of national accounts of the UN, and so we're very clearly aligned with the UN Statistical Commission framework. It's very important when we do assess the performance of a system that we make sure that we have effective data, administrative data, on what has explicitly been happening. What we use household survey data for is for calibration. And that is very important as well, to ensure that the system is adapted to the needs of the population, and for the design calibration is fundamental. So the Social Security Inquiry has been pushed forward as a very important means of implementation and monitoring of social protection extension progress. And the ILO is very proud to be working with the World Bank on this, and to make sure that we are consistently being capable of arriving at clear frameworks for each country. And we're hoping that by 1st of January 2016, we're able to help countries that train in their own statistical monitoring and what it means in relating to their own institutions. And they're the challenge when you have, as Ruslan mentioned, 20 social protection schemes. How do you relate to these 20 average social protection schemes? So, and there, the more these information are consolidated into a single database, the more we're capable of showing how self-financed social insurance schemes are important, not to burden too much the tax finance social assistance budgets of the state.
Thank you.
So,
and that, of course, a crucial issue, the effectiveness of the system, being able to show, because we've heard a lot of arguments through the day about communication and how we need to be able to communicate this. We heard the argument made very forcefully in the last panel as well, that it is an investment. Then you get a return on your investment, that countries, for example, have withstood the crisis better if they have invested in social protection. But we need to be able to prove that, don't we, if we are to win that argument. Do you think we have what we need? Fabio, Francesca, a thought on that? And Francesca, particularly, how important is it not only to make the communications case, but to design effective policies? Do we need to change what we're measuring, how we're measuring it? A thought from... and then Fabio.
Thank you. On the measurement side, well, I think it's clear that we need both household survey data and administrative data. We need both. That's very clear, particularly if we're interested in saying something beyond a description on, say, numbers of participants. But if we are talking about any measure of effectiveness, we will need both. And just to say that the fact that we don't yet have the ideal systems in place or databases in place is not necessarily a bad thing. I mean, we wish we had, but let's work towards that. I think that the whole SDG framework presents a fantastic opportunity precisely in this sense. So this is a good thing. Let's work towards the development of these tools and the necessary data. Beyond that, on effectiveness, yes, it's important to know what the impact of policy is, but it's just as important to know, it seems to me, what it is about policy that leads to particular outcomes. And here, again, there's a lot of work to be done. We haven't gone into this today, so we've repeated the fact that we know that social protection can be a very powerful instrument in reducing poverty, reducing inequality, leading to improved human development, education, health outcomes. But what are the properties of policy that lead to those outcomes? Because social protection doesn't necessarily lead to those outcomes. So we know very well that social protection can actually even offset progress and poverty reduction if poorly designed, if poorly implemented. And we do have some information, increasing amounts of information, drawing also on the experience of higher income countries that have a long tradition in social protection provision. But even so, a lot remains to be done, and actually that's where it gets interesting. What are the design and implementation parameters that facilitate the kind of outcomes we're interested in?
Thank you. Fabio, you mentioned services, and of course there one is talking not just about the quantity of services, not about just the coverage per se, but the quality of those services, and are they delivering, and are they delivering the outcomes? Because as Francesca said, it's not a given. Do you think we have the right ways of measuring needs and measuring progress now? What do you think, where are the areas we need to work on in the future? Then I'm coming out to all of you.
For service or?
Well, more broadly, but I was thinking particularly when you mentioned services, that's an area where it's not just numbers, it's not just quantity issue, there is a quality of services as well. So so more broadly, but using that as an example perhaps.
Okay, that's difficult because even if we only look for cash transfers, for example, and we think of administrative data and the household survey, for example, we have big gaps. And most social cash transfers, for example, in Africa, they are so tiny that they don't show up in the household survey. So basically, we just have the admin data and the information that's provided to the LO on the number of beneficiaries, how much it's costed. So we're not even able to use the household survey to calibrate for that. The other challenge is, for example, for the case of Mexico, Colombia, and Brazil, whenever you try to see the percentage of households that are covered by the conditional cash transfer programs, that in these countries reach more than 20% of the population, then we have the similar problem that you have in Europe, that we have underreporting of the cash transfers. Then you have, if you look at the administrative data, you have, say, 60 million beneficiaries. It shows up 30 million beneficiaries in the household data. So you have to calibrate for that and make sure that people, when you communicate, don't think that you are cheating. So there are technical aspects that are difficult to communicate and may start some policy debate that goes into the false, actually problems that you may face. On the service, it's even more difficult. In the middle income countries in Latin America, there has been much investment in service lately. So once these cash transfer programs have been established, the whole thinking now is how we are going to make sure that whoever needs the social assistance, the social service, can have access to it, and how this social service can enable the beneficiaries of social cash transfer programs to have access to the other social service. So that's something that in some countries can be measurable, in other countries much of a challenge.
Okay, thank you very much. I want to come back on the question of financing and delve into a little bit more detail. We talked in the last session about the principles, but let's, thank you very much, Frederick, come back on the question of how to do this in practice, and also on this capacity building that was underlined by our last panel as so important, and indeed the relationship between the two. But before I do that, does anybody have a question or a comment to what they have heard? either in this session or indeed in previous sessions, if anybody wants to come in. Yes, hang on just a second. And could I remind you, please, to introduce yourself and please be brief. Where was the hand? I've lost the hand. There you are. Yes. Can you pass it down the line? Thank you very much.
Thank you very much. Hildegard Lingner from the OECD Development Assistance Committee Secretariat, DCD. Thank you to all of you, and congratulations for the big breakthrough you managed to do on social protection over the past couple of years. And it's really great to have it in the SDGs agenda now. And this session is now about how to implement and finance it. So that's the question I want to ask to you, because we managed to have the Social Protection Interagency Board bringing together the key actors at the global level. So now we have to, as you all, I think, said earlier on, we have to make it happen on the ground. And we are facing financing, statistical, and whatnot constraints, especially in those countries who are most in need to get to set these things up and to get the proper financing and to monitor any progress that we hopefully see happening. So what are your plans, or if not yet plans, but what are your ideas, how to make it happen on the ground? We have, how many years, 50 years of experience with development cooperation on all these different sectors, and we managed to have different approaches in different countries with technical working groups and so on. What is the formula we want to have for social protection? Are we going to set up a new country working group on social protection? How do your agencies come together to make sure we have the data and the financing to get started?
Thank you very much indeed. Thank you. If you could pass the mic back to me. Thank you very much. I'm coming over to you, sir. I see a hand there and I see one at the back. I'll come, if I could ask the person at the back to move forward a little bit. I'll come to you second. I'll take one here and then I will come to you. But it's a bit easier for me if we sort of meet halfway. Where was the hand on this side? I see you now. Thank you. Hang on a minute, if I can climb round the camera without knocking it over. There we are. Thank you very much. And then you, sir.
Thank you. Remco from the Institute of Tropical Medicine in Antwerp. And it's a question on implementation and financing as well. Now, we talked a lot about domestic revenues and how they should tie in to make this possible. But there's a lot of analysis that this will not be sufficient. A recent report from ODI highlight that as well. And we're talking here about human rights, but there's also analysis that to do so you need to have redistribution policies and you need to have regulation. And we haven't spoken so much about that, and that there's a need to do that also at the supranational level, that there's also a requirement for transnational resources to fund the gap that currently exists. And I haven't so far heard so much about it during the conference. Maybe you could reflect on that.
Thank you very much. I will come back to you, but let me give the floor to the gentleman who came to meet me halfway. Thank you very much, sir.
Thank you. Tim Rosen, Action for Global Health. As a quick question, I was surprised not to hear the term pooled funding when talking about the financing. And it surprised me because the point was made, we want to move beyond social assistance. And then pooled funding is a way to ensure there's a move towards social protection. And from a health perspective, the World Health Organization does not specify what needs to be happening in every country, and there's not one size fits all, we said it before, but they do push for pooled funding, and they also push for mandatory contributions, not just voluntary assistance contributions. I'd like your input on that.
Thank you very much indeed. I'll take one more and then we'll go back to the panel. Madam, thank you very much.
Thank you. My name is Verena Knaus. I'm from the UNICEF office here at the EU in Brussels. And I just wanted to flag two issues and maybe get your insights on them. There's, of course, a very advanced debate inside the EU where social protection systems have a long tradition and data is by and large available, and there's no sort of substantive policy disagreement on the need for social protection systems as such. And still, there are sort of raging debates between universalism, targeted, progressive universalism, and I think Ms. Bastagli pointed out the crux of the matter. There are systems that spend a lot of money but don't deliver the outcomes we want to see. And from the child poverty perspective, there's huge differences with some EU member states, and of course around the world the same is true, that spend a lot of money but don't reduce child poverty or don't do it effectively. So I just wanted to flag the idea of progressive universalism The idea that, yes, you have universal systems, but you do still actually build in mechanisms to ensure that there's a redistributive factor and that the outcomes are what we want. And my second, just very quick question is, we talked a lot about the packaging, and you know, Jackie, you kept bringing it back. We need to win a public policy debate, of course, and especially when resources are involved, it's also about voters. And it's been interesting to see in the EU context how the crisis has hit hard, but age-old pensions and poverty among the elderly has by and large been protected. So we have seen no increase in poverty among the elderly, and we've seen a dramatic increase in poverty among children. With demographic trends the way they are, with an aging and getting, you know, societies getting older and older in middle income and lower income countries, how do we sort of buffer against this, that children in particular, as they are not voting and as they are in many countries sort of crowded out by demographics, that actually the social protection system will not be skewed against them in the future?
Okay, thank you very much. I'm going to come back because that's quite a lot already for our panel to deal with. And there was this broad question at the beginning about, okay, now we've got to make it happen, or post-September, we've got to make it happen. How you see your roles, the roles of the different institutions, what are you concretely going to do? And if we can address that from the two sides, and then perhaps come back on the more specific financing questions. But from the financing side, from the capacity building side, what do we do to make it happen? Who would like to come in on that first? Anne? You shouldn't catch my eye, it's always dangerous.
I would have preferred to have listened to others first. Well, what we need to happen, we could have a shopping list, or we could have a one-size-fits-all answer to such a big question. We need to roll up our sleeves and get the thing done. I think that's the most important. It's especially working with the countries, as I mentioned earlier, listening to their priorities. And in the fall, coming this year, we're going to have a meeting in Northern Africa to invite sub-Saharan African countries, to invite them telling not what their systems are doing and not doing and so forth, but what national capacities, problems do they have in fulfilling social protection. Because there are countries that want to help develop those national capacities. So listening to what these national capacity problems are, making sure there are more accommodative macroeconomic frameworks to allow the public sector to deliver social protection. We find in many countries, especially those that have had very strict structural adjustment programs in the 80s and 90s, most national training centers and national schools and programs for health sector workers, education sector workers, civil servants in the other social sectors have been closed down. If you go to Guinea, there's not a single national training center for social and health workers. So getting the means to the governments, having a serious talk with the international community, the financiers of this international community, and perhaps the SPIAC-B and somebody asked how do we actually make this work on the ground. The SPIAC-B has all the means and all the actors involved with the UN system. It just needs to get it done, but follow the existing systems. And at the country level, we have UN country teams led by UN resident coordinators. And these are the frameworks that are established. They have, for many of them, social protection committees. The ILO, Madame Helen Clark and Mr. Ryder called on the setup of one UN social protection floor teams. These are happening in a number of countries. They can continue happening.
So use the infrastructure, if you like, use the systems that we
We
already
don't need to reinvent the wheel.
And stock take on the capacity side. On the financial side, Francesca, if I can ask you, in terms of financing, we've heard a lot today about how there is the fiscal space within countries to do this, that virtually all of them can find a way. Some will need more support, some less, and the question then, where does that come from? But what do you see as the key steps that need to be taken to make it happen from a financial point of view now, to really make progress?
Yeah. So we had a question, and someone, colleague mentioned studies that show that many countries do have fiscal constraints, including very major ones when we're looking at lower income countries. And certainly if we look at trends in terms of domestic revenue mobilization, if we consider tax revenue alone, tax to GDP ratios in many developing or lower income countries have tended to be fairly stable. And where we do see increases, these increases are commonly the result of growing reliance on consumption taxes, so indirect taxes, which tend to be regressive, and on higher reliance on natural resources. That is a concern because of sort of stability, from a stability perspective. So in that sense, indeed, the picture doesn't look very good in terms of when we look at tax to GDP ratios and revenue from taxation. Having said that, there are opportunities, and we do know of countries where tax revenue has increased, and there is scope in at least 3 ways. So at least, so if you take a step back and you ask yourself, why do we see these trends in tax revenue? Why are they so weak? These are related to factors, sort of, well, economy-wide factors, but they're also linked to tax policy design and tax policy administration factors. So these are factors on which governments, and indeed all of us, I'm a researcher, but also policy practitioners, can directly intervene on. In terms of economy and labor markets, we know that high informality rates restrict the scope, for instance, for certain types of taxes, but that doesn't have to be the case. We can work towards, for instance, encouraging or promoting formalization, even though it can be very difficult. When it comes to tax policy design, we know of very high revenue losses because of some of the things that were mentioned earlier, including very favorable treatment of certain companies, for instance, in the area of mining, tax exemptions, but also so revenue gaps that arise from tax design policy that can be revised. And similarly, when it comes to administration, weak administrative systems that can be improved. And again, they're very direct examples of things that can be done. So I do have, again, strong faith that a lot can be done to improve tax collection and tax revenue. That doesn't mean to say that there's no role for additional multilateral financing for social protection. And in fact, again, as I think there was considerable agreement over the course of today, there is a lot of scope for that. What is critical is that this shouldn't in any way displace or weaken efforts to raise taxes or other revenue domestically. And we know that there are options, facilities to ensure that any additional multilateral financing is designed in such a way to encourage and further develop domestic resource mobilization. So the two things can work together. We shouldn't be seeing a trade-off between the two.
Thank you. Fabio, from your point of view, making it happen on the ground, how do you see the role of the different actors? And if you can pick up on any of these specific financing questions that we were asked.
Now I also want to be a little bit more optimistic. I don't think that we need to make it happen now in the ground. We are talking about social protection here because it's happening. So going back to what Isabel showed in the morning, the expansion of the slide that she didn't show, the expansion of the social protection, the coverage of social protection worldwide since the last century, it's quite amazing. And what has happened since the crisis, how many of the middle-income countries responded to it, it was also amazing, in the sense that they managed, even during the crisis, to increase what they were spending social protection. So the whole idea that the social protection can have this anti-cyclical effect came to be seen, at least in the middle-income countries. The proper existence of the SPAC-B is a proof of that. When the G20 asks the agencies to coordinate and help the countries to share lessons, and here it's quite important, it was this demand to share lessons from the middle-income countries to the low-income countries and see how the South-South cooperation could help them to learn more. So again, going back to Helen Clark, that's one of the challenges, how to make this South-South cooperation and the South-South, I prefer the word learning, and cross-fertilization between different approaches could help. For example, the innovations, they were talking about the mobile phone payments. That's something that we don't have in Brazil, for example. Our central bank legislation actually is a barrier for us to have this type of service that perhaps in the Amazon, the more isolated areas, could be something very, very important. The other point that I would like to treat is on the trade-off between progressive universalism, targeting, and spending lots of money and not having much of an impact. So many countries are facing the reforms of the fuel and the food subsidies, and they are discussing with the multilaterals, with MF and LO, what could be done. So I think that's a crucial moment in many countries on how they can build effective social protection systems that are not only poverty reduction strategies or poverty reduction policies. So it's a crucial moment in which lots of sharing and lots of support is necessary. How to be sure that families with children can also be protected is a challenge. We have been doing some work in the MENA countries, for example, with UNICEF, and it's quite hard, for example, to change the mindset that if you are able-bodied, you can work, so you shouldn't be receiving social protection, even if you have a child, even if you have too many children. So it's something very difficult, and in which I see the self-learning showing different examples on how that can be done together. The example of Brazil with the universal rural pension, combined with a Bolsa Família that has also a child focus, not only, but also a child focus, is one of the experiences that can be shared with this country. So I do think that child poverty is one of the biggest challenges in terms of how to convince countries that able-bodied families can receive also social protection benefits.
Okay. Thank you very much. Ruslan, you said in your opening remarks, you were talking about the crucial question of how to operationalize this. Precisely the question coming from the audience, and also about the different roles. And I wonder how you see the role of the different international organizations. That key question, which we've come back to time and time again today, of cooperation and collaboration, how to make it work and who does what. A comment to that. How do we make it happen? How does who does what to deliver it?
I guess already our panelists mentioned a lot of things that are happening on the ground to make sure the cooperation is going. I would like to mention a couple of things. One thing that is very important, and that speaks to the relieving some of the constraints, but also it's a huge challenge for us all working on the public systems. I'm not talking about NGOs. This is the role of private philanthropy. The private philanthropy is increasingly important vehicle to support social protection systems building, and it's very often not part of the dialogue and discussion, right? Gates Foundation, Bloomberg probably has more importance now and more bearing in these matters than some countries. So how we actually include, how we change the governance of the system in a way to account for this actual role, but also to channel these resources according to the national priorities and to the global priorities. That's a challenge and an opportunity as well. And this is what we need to bring in the existing mechanisms that so far are not inclusive of that. Now, talking about the what is happening and what are the roles, I would like to come back to the optimism note. And I actually was planning to speak this optimism talk, even though everybody picked up on this. If we go back 5 or 7 years ago to African countries conference of finance ministers, we will hear exactly the same mantra repeated over and over again, is that we are against social transfers in principle, we don't want to implement them, these are bringing the culture of dependency, we don't want to repeat the mistake of European countries that have introduced it and now don't know what to do with them. Now, we see such an expansion of this mechanism across the African continent, right? Now, 40 countries in Africa out of 48 have sizable cash transfer programs, which means that the policymakers are over this mantra. Right? How it happened? It was concerted effort of many agencies. UNICEF did a lot of advocacy work. FAO was really active on the ground in many countries, so as all organizations present here. But look how it happened, and I don't want us to get a little bit carried away by our systems talk. It was happened through a lot of experimentation, a lot of still you know, what may look as a fragmentation. Different agencies was trying their pilots to demonstrate that these things work, convince policymakers that nothing bad is happening, and then unleash the political economy force. And actually, I'm very optimistic about social protection because nothing can beat the force of social protection in terms of the social mobilization aspect of it. Once policymakers understand the potential of it, there is no way coming back. They are using it as part of their discourse, as part of their action. So what is important is to get over this initial hump of resistance, reluctance, lack of understanding. And this is where all of our efforts, the international organizations, NGOs are so important. And this is where it's so important not to shut down these experimentations that are still happening and not treat them as undermining the system's approach. What is important, and that is bringing back to the high-level panel we just heard, is delivering on the promise. We heard a lot about multiplier effect. These are still from very small-scale studies and experiments. How it's going to look like when these programs are scaled up to the national level. Okay. How we are making sure these things are paying off. I believe this is a big challenge for us for the next wave of the social protection.
Thank you very much. We are almost out of time, but before we do, you know, because you've been watching all day, I like to put my panels on the spot and try and draw some conclusions, some key next steps, identify where we go from here. And we've talked about a lot of issues, and thank you for that very concrete question from the floor on making it happen. For each of you, and I will start, I'll go this way this time. I started the first question at that end, so Francesca, I'll start with you. If of all the things we've discussed, you had to give just one priority to make sure not only that social protection takes its rightful place in the post-2015 agenda, but is implemented effectively and delivers, going back to Ruslan's point just there, what for you is the most important priority, key next step, call it what you will?
Okay, well, there are several, but I'll just mention one. And I will mention something that hasn't come up too much here, which is the political economy dimension. So yes, Ruslan just mentioned that indeed we have seen this transition, improving understanding of the potential for social protection to work. I think there's still more work that needs to be done there. And this is largely done through research that shows just how effective social protection can be, and what are, as I've said before, and under what conditions it is effective, and what are the design and implementation features that permit this. And then the effective also communication of these findings to policymakers, politicians, to help to ensure that there is political will, because without that, the truth is we know things don't happen, and that's absolutely critical. Yeah, I think that's
Thank you very much. Fabio, your priority.
So also go in the communication, and so stepping on the research, I think that one of the things that we have been doing at IPC, besides the research aspect, is actually to enable governments and managers of the programs to talk to each other and learn from the experience. So I think that's a very effective way to sustain and to enable the self-learning, so that aspects of policies can be adapted and the different countries can learn and build their own system.
Thank you very much indeed. Anne?
First, I would insist that social protection in developing countries should not be laboratories. We know what it needs to set up a social protection system. You need to have an institution, you need to have enough staff, you need to have a budget to pay your staff, and you need a budget to deliver the benefits you promise. We have constitutions in almost every country that state social protection and rights to the social protection benefits very clearly specified. So I think we need to just get serious at it. I'm sorry, we need research to improve, but we don't need to wait for research before acting. We know what's needed, and when countries have established, we're working in Bangladesh setting up the employment injury insurance scheme, perhaps if the government and social partners want it. We don't need to experiment. We know how much it costs. We know how many regional offices are needed to be set up. We know what needs to be done with the different actors. It's just a matter of putting down the resources and getting the thing done. But please, no laboratory with developing countries.
Thank you very much. Ruslan?
We talk a lot about systems, but we forget that there are people behind systems. And everywhere we see social protection as a success story, there are agents of change. So I think the most important thing is investment in national capacities to think about social protection. And this is where the efforts of training institutions are really important. And in all of our discussion of scaling up support to the governments, I would like not to forget about the importance of this knowledge transfer.
Thank you very much, and thank you for reminding us it is people who are at the heart of everything we are talking about. And as we've said all day, not just an end in itself, but so much an enabler of all those other things. Ladies and gentlemen, will you join me in thanking our panel very much indeed?